Hello, good day, Nigerians. Thank you for joining the conversations tonight. Tonight we're going to discuss on issues. Tonight we're going to discuss on issues bedeviling Nigerian victims. As we all know, following the rising insecurity in the country, which has resulted in the displacement of hundreds of thousands of people from their comfort zone, and that has actually alleviates their suffering. Uh, However, we also have victims of climate change, which is a natural disaster, and sometimes it can be an artificial, which also threats. Also, we also have victims of stigmatization, especially those battling with health issues, and we also have victims of social violence and then constant right abuse in Nigeria. As you all know, at daily episode, we always identify victims' challenge and we invite experts and professionals to outline possible solutions to their sufferings. I am Abubakar Ismail Kankara, and then I will be the one to anchor the program tonight. My host tonight is Aliyu Dawobe, the spokesman of the International Community of the Red Cross, that's ICRC, in Nigeria. Sir, you are welcome to this program. Welcome on board, sir.
Thank you and good evening, viewers.
So, sir, yes, in the ICRC, you have engaged with victims, especially victims of armed conflict and violence, which has actually generated severe humanitarian concern. So, I would like to know what is actually the Red Cross doing to address the plight of victims we have in Nigeria, especially the victims of armed conflict and violence.
Again, thank you for giving me the opportunity and good evening, viewers. Introduced, my name is Aliyu Daobe. I'm the Public Relations Officer of the International Committee of the Red Cross here in Nigeria. The International Committee of the Red Cross is an organization that has been working for more than 160 years. Based in Nigeria since 1988, we've been working together with the Nigerian Red Cross Society. In answer to your question, the ICRC's mandate is mainly to assist and protect people that are affected by armed conflict and violence. This is the mandate. And also to promote the respect for international humanitarian law, which is the law of armed conflict in the world. Specifically in Nigeria, this is what we are doing. Unfortunately, Nigeria has been faced with a lot of conflict in the last 10 years. In the northeast of Nigeria, we've had situations where people have to flee their homes. So people flee their homes because of conflict. In the north of Nigeria now, we have more than 2 million people on the move. People running away from their comfort zones, like I mentioned by the producer, and trying to get access to safety. This is the situation we have found ourselves in Nigeria. And this is the situation where a lot of communities, hitherto existing relatively peaceful in their communities, undergoing their agricultural activities, undergoing their small businesses and earning an income for the families, where children are able to have access to schools, children are able to get access to medication, pregnant women, lactating mothers are also able to have access to medication and treatment also. Unfortunately, this changed because of conflict going on in some of these areas, and especially in the northeast of Nigeria, and people have to flee. So for the International Committee of the Red Cross, like I mentioned, our mandate is to assist and protect people that are affected by this armed conflict and violence. You can see that the northeast of Nigeria, where we have armed conflict going on, a lot of people are affected. In the north central states of Nigeria, where we also operate, we also have a number of people that are also affected by communal violence, and so on and so forth in the north central states of Nigeria. Down in the south, we also have presence, like we have an office in Port Harcourt that covers the south of Nigeria, where we also support people that are affected by some of these situations of violence that are present also in the south of Nigeria. So this is how we are spread. We try to support these people. When I talk about support, we are talking about a range of activities that we are doing. This range of activities has to do with providing emergency when I talk about emergency assistance, I hope you can hear me. Hello, can you hear me? So when we talk about emergency assistance, we are talking about things that have to do with food, water, medication, and so many things that are linked to this one. We also have to talk about other things that are part of this. When situation becomes normal and people are able to go back to their normal businesses, then that is where they also need support that should be given to them in terms of how to rebuild their livelihoods, to give them some seed and fertilizer for those who are farmers to go back to farming, to give them some tools so that they can still go back to their businesses, and sometimes also to give them some cash so that they can start. Cash not be a huge amount of money, but a small amount of money that will make them to start all over again. So this is what we've been doing in Nigeria, and especially in the northeast of Nigeria, where we have the huge of our operations going on. Hello, can you hear me? I'm not sure if you can hear me, but if you can hear me, I can't hear you. Okay, thank you very much for that. So this is what we do as an organization, and in the course of doing that, we have to execute our what we call the humanitarian principles of the Red Cross and the Red Crescent societies. Executing these humanitarian principles means we have to relate with all the people that are affected in the conflict. If one, two, or three people are fighting, that generates this type of displacement that we get usually in conflict areas or violence areas. What we do is to try as much as possible to meet with all the actors of the conflict, to understand the situation, to not to ask questions on what happened and how or who is at fault here, but what questions we ask are actually questions that are related to the situation that happened. We need to understand what happened to people. We need to meet with them directly to be able to discuss how we can support them. This is the bottom line, is to be able to understand the situation and to do what? To support them based on the need they provided or they are looking for. So this is how we do this. To do this, we also have to be an impartial organization. Impartiality for us means we don't consider the color, religion, or the race of a person to give him assistance. No, what we consider is mainly is the needs that are available. Someone who has been living in his own home now has been displaced in a makeshift camp. He doesn't have a bed to sleep in. So we try to give him the basic things that have to be like a mat to put your head on, a blanket to cover your head to avoid cold, and some clean drinking water around so that people will be able to have water to drink, water to cook their food, and of course we also provide people with food that they would be able to eat food, not the way they were eating, of course, at home, but this is something like just to keep them together until they are able to have some safety, and they will be able to go home, back to their homes and continue with their normal life. So this is the way we operate in Nigeria. Like I mentioned, a lot of activities are going on. Victims here victims of conflict could be divided into direct victims or indirect victims of conflict. Direct victims are people that are directly affected. Their homes have been set ablaze, or even if the homes are existing, they have to flee and leave these homes. So these are the people that are directly affected. They move into other communities. These communities they move into now are indirect people that are affected because they are not hosting these communities that have been affected. Now, the resources available in these host communities become scarce now because the number of people that are using these resources have multiplied. They need to be expanded. So sometimes if we come to communities where we have displaced people, where we have people that have been affected moving and are hosted by other communities, what we do is to look into the situation, to look at the primary health centers of these places. Are the medical staff enough to be able to cater for this surge of population that have come in to meet these people? Do we have enough midwives to be able to manage the population that are moving, that have come into this place? Do we have enough drugs in the hospital? Do we have enough rooms to be able to cater for these people that are coming in? So here also we try to work with the authorities that are on ground, with the primary health center authorities, with the state government, with the local government authorities, and sometimes with the federal government to be able to see how we can assist. At the primary level, we try to work with the primary health center staff. At the state level, we work with the specialist hospital and the general hospitals that are providing services so that those who are supported at the primary health centers, if they are moved to the secondary health centers, they should be able to find better medical treatment. Those who cannot be treated at the primary health centers, maybe their situation is big enough to be moved, to be referred to these bigger hospitals, then we also try to do that. Imagine a person uh, who is affected by conflict and then coming to a hospital and asked to be paid to pay something to be able to get medical care. That doesn't happen because he does not have the money. So what we do is to try to see how we can support these clinics so that people that are coming are given medication free of charge. We pay for these services so that they will be able to get free medication when they come here. If we transfer these people to this specialist hospital, like in Maiduguri Specialist Hospital, we work closely with the authorities to know how we would be able to support these people when they are referred to this hospital. Here also, they are not asked to pay because their situation has gone beyond the management of the primary health centers. It has come to, at the state level. So here we also give them free medication when they come in here. For those that are unfortunate that have their legs or parts of their limbs amputated, this is also a very big challenge that has happened in conflict situation. The ICRC has related very well with the authorities on ground. In Kano, for example, we've been working with the Dala Orthopedic Hospital for many years to support people that are affected and their limbs have to be amputated. We fabricate artificial limbs for them that they could use when it comes to learning how to walk again, to gain a living from despite the fact that conflict has happened. So in Maiduguri, 2 years ago, we also donated what we call the primary physical rehabilitation center that is specialized in addressing issues that have to do with supporting people that are amputated with artificial limbs so that they will be able to walk again in their lives. So in Maiduguri, we donated this to the University of Maiduguri Teaching Hospital. We are still working closely with the University Teaching Hospital to manage this physical rehabilitation center in Maiduguri. So this is what we have been doing. In terms of rebuilding livelihood, this is something also very, very important because when people are affected and leave these areas, we try when they return to normal places or even in places where they are displaced, they find that it is good for them to go into other to go into other businesses. We try to support them. Presently, we are trying to vaccinate livestock, more than 1.3 million livestock in Adamawa State. Most of these livestock have been affected by the conflict, and the chain of vaccination has broken because they either the herders are afraid to get access to these vaccination places where they can get genuine vaccines, or the doctors are afraid to go to some of these places to vaccinate the livestock of these people. So what we do is to try to become a bridge between these people and the herders so that they will be able to come back with their vaccination in case they need this vaccination. So Adamawa State, we are vaccinating 1.5 million cattle. Plateau State, in Jos, our office in Jos, vaccinating over 200,000 livestock in Nasarawa State. We have already vaccinated about 450,000 livestock in Yobe State. So this is what we will keep doing. For agro, we have done a lot in trying to rebuild the livelihood of farmers. Presently, we are kicking out a campaign for supporting farmers with irrigation, with seed for irrigation, so that they will be able to cater for their families. So, in short, these are some of the few things that we do in the ICRC when conflicts have affected people. to come down to what we are also doing to journalists is very important, because when we talk about people in conflict situation, journalists will have to fit in this situation, because journalists are part of the people that are also affected. In